Our studio guest today is Walters Kamaya, who is the Public Relations Officer from the Ministry of Health. We're looking at the alarming 2026 malaria data, which shows that thousands of cases are overwhelming the northern regions. Good morning, Walters. Thank you so much for joining us.
Good morning to you too, and good morning to the viewers.
Great. Now, the Health Minister, Dr. Esperance Lubindao, recently reported 8,760 confirmed malaria cases in just the first month of 2026. That's a 68% jump from 2025. Now, to what does the ministry attribute this rapid escalation, and especially since 20 health districts have already surpassed the epidemic threshold?
Yes, thank you very much. Let me appreciate the way you pronounced my names correctly. Yes, we want to say that in most cases, we say that Namibia usually experience the seasonal malaria transmission, and then this seasonal peak starts in December and until in April. So this could have been to that we have received high rainfall this year, and then when we receive high rainfall, there are things like stagnant water which can be found around the household, around the villages, around the residents, and then on top of that also we experience the tall grasses and so forth, and then this could be some of the factors, because this is where the mosquito can breed so easily, and then when they breed they multiply and then they come and bite people and so forth. So that's the cause of the transmission.
Now, with Katiba Mulilo and Otapi accounting for nearly a third of all these cases, what specific regional factors are driving these localized surges? I know you've mentioned the high rainfall and the grass. Maybe what other factors could be affecting?
Some of the factors we faced, when the ministry conducted the spraying campaign into the region. So we received some refusals in some other parts of the country, in some other regions. So this could have been that most of the households did not allow us access to spray into their houses due to various reasons that they have cited. So this could have been the contributing factor to those, when we look at statistics-wise.
Now, last year, malaria was unexpectedly reported in Windhoek. Has this 2026 outbreak continued to spread to the non-endemic areas, urban areas, and what does this mean for Windhoek's public health preparedness?
Yes, to the preparedness, if you are looking at those 20 health districts, I don't think Windhoek is one of them. It seems that Windhoek, we are trying to adhere to the messages that the Ministry of Health and Social Services is preaching to the community. When we follow the messages, when we follow the guidelines, when we follow the advices that comes to us through our healthcare workers, definitely we will not be found vulnerable as far as this malaria transmission is concerned. And then we want to commend those regions that are rising up, that are cooperating with the ministry, because this is for our own good. We'll also go out to those 20 affected districts also to give them public education awareness as far as malaria is concerned.
Now, is the ministry currently facing any shortages of anti-malarial drugs or testing kits in the most affected northern districts?
Not really. We want to say that the ministry is prepared, but what the ministry is looking for is for the public to play its part. If we are to think about preventive measures, in fact, let me put it this way, that it has been a problem when we just look up to the ministry. We want people to understand that this is a collective responsibility. The community themselves, they have to do their part. We should be able to engage in a gear of preventive health. Preventive health, the ministry have been preaching, have been talking about preventive measures for malaria, which is the removing of stagnant water, putting on long sleeves at night and so forth, removing the grass among besides around our places. So these are the things that we need the community members to start doing. If we keep saying what is the ministry doing, what is the government doing, we will not move an inch. We need to ask ourselves what or how can we help the ministry to cap up the spread of malaria.
Well, Mr. Walters, thank you so much for joining us on NAMIBIA Connect this morning.
It was a pleasure having me. Thank you.